Hello, this is Dr. Gay from First Look MRI, and this is a patient who has an injury or fracture of their base of the thumb, and we're looking for the ligaments and tendons to see what are injured here. And really the aim of the video is to show you where the abductor, ABD, abductor pollicis tendon versus the ADD, adductor pollicis tendon. And so we're going to go to, see this view right here. So this is an axial view, T1 weighted image. So in the deepest muscles here, we see one coming horizontally here, close to the digits. This is the ADD, adductor. Adductor pollicis is going to come across sideways here, and it's going to come across, and it's going to give an aponeurosis. That's going to go over the ulnar collateral ligament, which is about right here. So this linear band may be part of that aponeurosis, but just know that that's going to be in the front here on this view, more dorsal, and the central tendon is hard to see because it comes obliquely and it's small, and it'll fan out and cause that it'll become an aponeurosis, the adductor aponeurosis, going over the top. And on the other side, towards the palm, and far on the outside, we see the opposite one. This is the abductor pollicis brevis muscle and tendon. There's that central tendon that's going to come over, pass up the joint. There's a joint. It's going to pass it up, and it's going to attach on the base of the proximal phalanx of the thumb over here, right over here. And so we're going to see this on another view. If we look on the coronal view, we can see the thumb. Here it is. There's the thumb. We have the ulnar side. This is towards the hand. The ulnar collateral ligament. We should see a dark band here, but we do not. It's gray. And so the ulnar collateral ligament looks like it's partially torn. And then this is the adductor. See that central tendon and then the muscle. And that central tendon is going to come over here, fan out, and attach over here in this broad aponeurosis. Again, that's superficial to the ulnar collateral ligament. And on the radial side, the radial collateral ligament comes off the head and goes to the base here. So it looks like the radial collateral ligament we really don't see very well because it's partially torn, and the patient has an avulsion fracture from the metacarpal head and also from the base of the proximal phalanx here. So it's hard to see this, but there's a little horizontal black line, looks like a smile. That's a piece of bone that's rotated downwards, and that's right at the attachment of the abductor pollicis brevis. So this is the abductor pollicis brevis tendon coming across. We're going to see it pass up the head, and it's going to come over here and attach right over here in the base, and it's coming right up here to attach on this chunk of bone. So this is the abductor on the outside, attaching way over here in the base, and this is the adductor over here in the thenar region, closer to the hand, that comes obliquely horizontally here and attaches over on the other side in this broad aponeurosis. So now I'll show you the x-rays that show the fracture here. You can see this is that fracture fragment that should be here, but it's rotated down. That abductor pollicis brevis tendon attaches right there, and it yanked it right off. And over here, we have the ulnar collateral ligament will come across here, and this maybe partly at the attachment of the UCL, and maybe the abductor ponens. Some other ones attach over here along the first metacarpal head area, so that may be at the attachment there as well. But the main thing is the medial side or inner side here is going to be the adductor ADD, and the outside here is going to be the ABD. Hopefully that's helpful. It's always a confusing thing for me personally, so hopefully this will help us all keep it straight. Thank you very much.